everybody, it's Dr. Tracy Papa. Have you ever wondered what it would be like to have a child born with Down syndrome? Every parent who's expecting a baby thinks about that in the back of their mind, mostly because we offer testing for that, since that's the most common chromosome abnormality to result in a live birth. Today we're going to meet the Jensen family, who received Tori's diagnosis of Down syndrome the day after Tori was born. Not only that, she had a birth defect involving her heart that required surgery pretty shortly after delivery. They didn't know what to expect going in, and they're going to talk about what life is like with Tori, what their family life is like, and how much of a blessing it is to have a child in your life who makes friends for you, how you meet people that you never would have met otherwise and connect with people in a completely different way. Tori's very special. I think you're going to love this family. Enjoy the episode.
Hi, my name's Azure Jensen. We live in Fort Worth, up in North Fort Worth in Keller, Texas, and my husband and I have 3 children. Wade is almost 16, the end of this month. Camden is 10, and she's in 4th grade. Wade's a sophomore. And Tori is 6, and she's in 1st grade this year, and she is our child with Down syndrome. Our pregnancy was very uneventful with Tori. I have a clotting disorder, and so we knew that with that I would be monitored very closely. We had probably between 6 and 7 sonograms or ultrasounds, throughout the pregnancy, and there was nothing to clue us in to having this child that would be any different from our other pregnancies. Our birth of Tori was very normal. I was induced because I was on Lovenox, which is a blood thinner, and I had to be taken off of that before the delivery. So it was scheduled induction at 39.5 weeks. We had no indication that anything was wrong. They were watching her pulse oxygen and stuff was being watched because they were saying that she was turning a dusty rose color, which I was like, okay, go ahead, take her away. I need some sleep. This is totally fine with me. Everything was perfect. And it wasn't until the next morning, at about 7:30 in the morning, when the pediatrician came in. And that's when everything changed.
I was sleeping on the pull-out couch in the hospital room. They had taken Tori because the night before her blood oxygen levels were a little bit lower, but nothing to worry about. We're like, take her, it's number 3, this is easy, send her on her way. And we were awakened somewhere 7:30.
The rounding pediatrician came in about 7:30 in the morning. I had just woken up, everything seemed to be going fine, and the pediatrician said that he had spent about a half hour with Tori and that they would be sending tests off for Down syndrome. And that's about exactly how he delivered the news.
I forget the exact words he said, because the first sentence, I think he came in and he said, "I just spent 30 minutes examining your daughter, Tori, and I believe that she exhibits the traits of Down syndrome." I'm a pilot, so I'm used to hearing technical jargon, and he went in and gave us all these things that gave him pause or reason as to why he came up with this diagnosis.
There was no, hey, why don't you come over here and sit by your wife? I have some news to tell you. We've always thought that there's no easy way to give bad news. But as I have said many times, we felt like we were kind of punched in the nose with the boxing gloves, the way that he delivered the news.
The part that made it difficult for me was I'm sitting there halfway across the room, standing there in shock, just like my wife was, and I wasn't able to comfort her, because it was, when he told us that, I said, "Can you go back to the second sentence and say it again?" And because it was just so overwhelming. Looking back on it, it hurts a lot. Not in what he said, in just the way that it was done, because something that's so important like that, it seemed nonchalant to him. And I'm sure every 727th baby that he looks at has Down syndrome, and for him this might be normal, but for that 1 out of 700 babies or parents of the baby, it's not normal at all.
We got that diagnosis. It was very scary and hard, and 2 hours later they came in and told us that she had a full AV canal heart defect, which very well could mean immediate surgery right away. And so we went from having this diagnosis of a child that very well had Down syndrome also to a very, an issue that could be, life or death. As far as we were concerned, having a baby that's 7 pounds and possibly going into immediate heart surgery. It was very hard to take. My doctor at that point did not know that she had Down syndrome. And he came in a couple hours later, and we were obviously both pretty upset and everything. And when he came in, I was just a mess still, and he was kind of like, "What's going on? What's going on?" And I couldn't talk. Matt was a mess, and our nurse, whom I'm still friends with today, just absolutely love her. She was really great and was very helpful in those first couple days. But she had told him, she leaned over and told him that there were chromosomal issues and stuff. And I remember him looking at me and grabbing my hand and telling me it was going to be okay, and that it was going to be okay, and that we didn't need to worry. And that was really nice of him to do that, and we needed that at that moment. They said that she had a possible PDA, which usually closes, as most people know, right away, but with the kids with Down syndrome or other chromosomal issues might take a while, and and then they were also looking at her aorta, which in children with Down syndrome, the aorta can be very small, and so they wanted to put her down to Cook Children's, and so they got her all, tied up and sent her down to Cook Children's while we were still kind of trying to take things in and worry. And at that point I'd been discharged. Thank goodness the delivery, everything was fine, so I was able to go right away. And when we got down there, they had her all checked into the heart unit, and she was all cuddled in with the biggest Texas-sized bow you've ever seen in your whole life, and I about died because I was like, wow. It was very, very cute. So she was there for 5 days and got checked out, had numerous, ultrasounds and everything like that, and they determined that everything was good, but she was going to need heart surgery. And that was determined that she had to be 7 pounds of 13 ounces, so she had to gain literally about 10 ounces of weight in 9 weeks. And the day we went in for surgery, she was at 7 pounds, 13 ounces. So then she was admitted in September of 2012, had her surgery. We were in the hospital for 13 days because, she had a couple setbacks, but she did really well in her recovery, and haven't looked back since. I only think it was different because I was definitely going through a mourning process. And I think that anybody that tells you that they don't mourn that perfect child is lying. That's my opinion. Because the things that run through your head when somebody tells you there's something wrong with your baby is infinite, the things that could happen. So I think looking back, she was just a baby. We had a baby. I cried a lot. But I can honestly say, I think that first night when we found out, my husband cried, and it was heart-wrenching. If you've ever heard a man cry, it's not great. And that first night was really, really, really rough. But I don't know if he's cried since. I wish I could say that for me. I've cried many tears since. It's been a while. But in that first month or so of life, it was hard to look at her and think of the things that she might not do. And that has definitely changed in this last almost 7 years of her life. Now I'm like, what can't she do?
Tori never felt any different when once we had her than any of my other children. She's made me more patient in some aspects, but I don't really treat her a whole lot different than I do my other children. People who have, more than one child will say each child's individual. They all have a different operating system. They all respond to different things. They all think differently, and she's no different than my son, who's completely opposite to her, or my daughter, who's 10. They are all individual, and I treat them individually. With regards to my wife and how we parent, I think we're better parents together, just because we have to communicate more. There's things at school where we pay attention to school a little bit more. There's certain things that we pay attention to more. Our communication's a lot better, probably because of Tori, because we have to talk and how are we going to handle this challenge or that challenge. That's benefited our other children as well, because it's made it easier so that we just tackle everything head on a little bit more than we ever did with just my first two around. In our case, Tori is fairly close to typical development, but at the same time it's a little bit slower, and we've learned to not place expectations on her development, that she is who she is, she's going to do what she does. We push her just as much as we do our other children. She walked at 16 months and our other children walked at 14 months. She was eating dinner at the table maybe a month or two later than our other children. So it's typical, yet it's not typical. It's just a different journey that you're on. It's not anything, I haven't found it to be negative, it's just a little different, but it's mostly the same.
I think that once I decided that I was not going to worry about, timetables and stuff, and we're just going to let her do what she was going to do, and she amazes us every day, with the things that she knows. She's reading, she's in first grade, she's so kind, and she's got just the sweetest little heart.
She is a light. She always comes into the room. Every night at dinner time, she has something witty or funny to say, or a comeback to her siblings. She doesn't view things through the same lens that you or I do. I think she views the world like probably most of us should view it. She doesn't put the same limitations on other people, her friends, those around her. She's quick to give a hug. If someone's crying or there's another child that's crying, she wants to go over and give them a hug and tell them it's going to be all right. It changes your life in so many ways. You don't see it, I guess, until someone stops and asks you, how did this change your life? And I haven't found any negatives.
She's teaching us every day to be better people. If we could love the way that she loves, I think that things in this world would be a lot better if we could see the world through her eyes.
The Jensen family is wonderful. They received their diagnosis of Down syndrome after Tori was born. Some people receive this diagnosis before the baby is born. But however it is that you receive this information, there are things to keep in mind. And I'm talking to you, medical providers and families who are receiving this diagnosis. First of all, the diagnosis should be delivered by someone that you're familiar with whenever possible. So your own pediatrician or family medicine provider or obstetric provider, not somebody that you don't have a relationship with. And if possible, both parents should be in the room and any family members that you want. Preferably, if your baby is born, the baby should also be in the room, and you should refer to her by name. And you shouldn't say, "I'm sorry." You should say, "Congratulations." So these are some pointers to keep in mind when delivering this news. It's big news. Also, for you parents, don't set your expectation or don't let anybody define what's possible for your child, because you'll find this out along the way. And do make connections with other families who have children with the condition that your child is expecting to be born with, and they'll make things a lot easier for you. Help is there. Reach out to your community. Don't forget to like this video and subscribe for more great content. Also, you can find me on my website, drtracypapa.com. If you'll fill in your email address, I'll send you more great content, including a great free guide to self-care during pregnancy. Stay tuned. See you next week.